Healthcare in India faces several challenges, including inadequate access, low insurance penetration, and a growing chronic disease burden. The Indian government's Make in India initiative is encouraging domestic manufacture of medical devices and helping lower the prices patients pay for products such as stents and implants, which in the past were imported. At the same time, in India, the policy, environment, and regulators need to accommodate technological inventions such as growth of online pharmacies with the requisite controls in places, according to the panelists. According to a paper by All India Institute for Medical Sciences, patients' non-adherence to medication ranges from 24% for cardiac patients to between 50 to 80% for hypertension patients. The reasons include complex medication regimes, exhausted medication supplies, and adverse drug reaction, it noted. India, like most other countries in the world, has been battling the COVID-19 pandemic for the past few months. To limit the spread of this virus, Honorable Prime Minister Narendra Modi called for a complete nationwide lockdown from March 25th and April 14th. However, due to the rising number of cases, this lockdown was extended until the first week of June, and we have now moved towards unlocking. While addressing the nation to inform billions of Indians about this extension, the Prime Minister also asked every citizen to download and use a mobile based application named Arogya Setu app. Social distancing has become the new norm for most Indians today. Amidst this pandemic, at such a time, people need to stay updated regarding contaminate zones, virus hotspots, and more related information. This Arogya Setu app is a government initiative to ensure the utmost safely for its citizens from this deadly virus. In essence, this application connects Indian health services to its people at this unpredictable time. Through contact tracing, the app can notify a user of any hotspot or high risk areas near his or her residence. It can assist a person to adopt adequate measures to avoid infection. If the app highlights that your house is located in one such hotspot, you need to start taking standard precautionary measures against the coronavirus infections and ask your family members to do the same. App users can also understand whether they are currently exhibiting symptoms associated with COVID 19. The mobile platform can help with the self diagnosis and inform you whether you should consult a doctor or not. At present, the Arogya Setu app includes three primary sections, each with their own uses. These sections are your status. The Arogya Setu app help you avail the following benefits. Assess whether you are residing in the hotspot area where virus occurrence is high. In addition to this, we learn about the various safety guidelines that we and all should follow to avoid infection. Apart from its other functionalities, this application also received an update with the e-pass facility. E-pass refers to a government initiative that allows providers to essential service and commodities some relaxation from the countrywide lockdown. This session within the app contains a unique alphanumeric code along with a QR code. Self assessment COVID-19 update. Your status in this session, as the name suggests, determine the risk factor of the user to contract the disease. To assess your risk, the app consider your age, the people who you come into contact with, the area where you reside. Users of advanced age are more likely to suffer from coronavirus. Similarly, those residing in hotspot areas suffer from increased chances of contracting the virus. Self assessment is a questionnaire session through which users can self diagnose whether they suffer from coronavirus. You need to answer every question regarding your current health condition. Based on your answers, the Arogya Setu app can determine whether you may have contracted the virus. In case of positive assessment, the app will also provide guidance regarding the next step. Users can check the app understand whether they should follow precautions or seek medical attention based on the self-assess result. COVID-19 update session allows you to stay up to date regarding the number of cases, both locally and nationally. The accurate numbers can help you assess your risk future. Further, the availability of official updates prevents rumors and misinformation from spreading. The Arogya Setu app is available for download on both the Google Play Store and the Apple App Store. It is completely free to download and use. At present, the Arogya Setu app supports 11 languages. The inclusion of the regional languages ensures that the program is easily accessible to people from across India. Arogya Setu app, which means bridge to health in Sanskrit. India has made it mandatory for government and private sector employees to download it. But users and experts in India and around the world say the app raises huge data security concerns. Using a phone's Bluetooth and location data, Arogya Setu lets users know if they have been near a person with COVID-19 by scanning the database to know cases of infection. The data is then shared with the government. If you have met someone in the last 2 weeks who has tested positive, the app calculates your risk of infection based on how recent it was and recommends measures. Abhishek Singh, CEO of My Government at India's IT Ministry, which built the app, told the BBC. While your name and number won't be made public, the app does collect this information. If I am on the third floor and you are on the fourth floor, it will show that we have met. Even though we are on the different floors, given that Bluetooth travels through walls. At lastly, Arogya Setu app keep you safe, keeps your near and dear ones safe, keeps India at large safe.